Hi, and welcome to In Our Community. I'm your host, Erin Nelson. Today I have joining with me Dr. Haresh Jangiani. And Dr. Jangiani is a hematologist-oncologist with Compassionate Cancer Care here in Corona. He is also the medical director of the cancer program at the Corona Regional Medical Center. Welcome, Dr. Jangiani.
Good morning. Thank you, Erin.
And we also have joining with us Dr. Carlos Del Campo. And Dr. Del Campo is a cardiothoracic surgeon and physician champion for the lung cancer program at the Corona Regional Medical Center. Welcome, Dr. Del Campo.
Thank you.
Dr. Jangiani and Dr. Del Campo, tell me how long you've been practicing medicine and how long here in Corona?
Erin, I've been in practice in Orange County for the past 17 years. I came to Corona the past 5 years ago. I was here just for 1 day a week. The practice since then has grown, and we are working here every day, and we are 5 physicians in our group.
And Dr. Del Campo?
I've been here in Corona approximately 12 years. And over the past couple of years or so, Dr. Jangiani and I got together and got this idea about developing this new program about lung cancer, and this is what we're doing now.
I see. And what was the reason for you to come and practice here in Corona?
Well, I've been practicing in Orange County for about the same amount of time. I have a very busy practice. And then we both realized that approximately half of the patients from the Corona area come down to Orange County to have surgery. Mm-hmm. So we figure, well, there's a very large number of patients here, and they deserve to have this kind of service here in their own community. So it'd be easier for me to come here and help them here than all of them to go down for me to operate them down there.
Right. And is that the same kind of reason for you too, Dr. Jangiani?
Actually, I came in different circumstances. As I mentioned to you, I was in practice in Orange County. We had a very busy practice. And Dr. John Calderon, the CEO of this facility, had seen us at New York discussing some new innovative treatments in oncology and invited us to come to this area. So we came here 5 years ago in the hopes of stopping some out-migration, improving the services, as we had heard complaints and rumors that patients were moving out of this area to seek better quality care in Orange County.
Right.
So we decided to bring care back to home, to the community in Corona.
So then the main reason why people would go outside of the area is because they're not aware of what you have here to offer at the hospital?
Partially correct. That's absolutely correct. Actually, there has been a lot of out-migration in this area for the longest time. And often people in the Inland Empire have gone out in Orange County, not to Orange County as such, but to medical centers such as UCI, UCLA, City of Hope, to receive their care there.
Right, right. Well, regarding trends in cancer, what are some of the procedures and improvements that you have seen evolve within the past 5 years?
I would say we've come a long ways in cancer medicine. Cancer is no longer a secret. Patients often talk about it, so there's early awareness of cancer, there are early detection programs. Breast cancer screening, as you know, has had a major impact on quality of life. We've had colorectal screening, which have changed quality of life. So newer drugs, patient awareness, early detection programs have had a major impact in cancer care. And the most newest medicines are the target therapies, drugs such as Herceptin, which was on the news, as you know, just a couple of days ago. Drugs such as Avastin, drugs such as Rituxan have truly had a major impact on quality of life and survival of patients. As a result, patients with breast cancer today are living for 15 years. Patients with colorectal cancer have an improved survival. So things are changing in the world of medicine.
What are the most common types of cancer that you are treating in our community?
We treat all kinds of cancers, so there is no restriction as to which cancer we do not see. So we see all types of cancers, but the majority of the cancers that we see in this community are your common cancer, which is your breast, lung, colorectal, prostate. And of course, when we first started coming here, we were seeing a lot of lymphoma, which is a cancer of the lymph gland. So we see all kinds of cancer in this community.
Mm-hmm. And as far as an age group, is there a certain or particular age group that maybe you tend to see more often than others?
Not truly. I mean, we've done studies, and actually studies have been done by the American Cancer Society, and there really is no true increase in the incidence of cancer in this community.
Right. Right. Well, let's take a quick commercial break, and when we come back, we'll have Dr. Jangiani talk to us about the importance of the Corona-Norco area having comprehensive cancer services. Don't go away. We'll be right back. Welcome back to In Our Community. I'm your host, Erin Nelson. Today we have joining with us Dr. Haresh Janjiani, a hematologist oncologist with Compassionate Cancer Care here in Corona. He also serves as the medical director of the cancer program at Corona Regional Medical Center. Welcome, doctor.
Thank you, Erin.
And also joining with us today is Dr. Carlos Del Campo, who is a cardiothoracic surgeon and physician champion for the lung cancer program at Corona Regional Medical Center. Welcome, doctor.
Thank you.
What is important that the Corona Norco area have comprehensive cancer services? And you kind of touched about it earlier, the importance of having it here. Why specifically?
Erin, cancer today is the leading cause of death in the United States. It's the #1 cause of death. Approximately 7,000 patients will be diagnosed with cancer in this community. 3,000 patients will die from this disease. Patients are more aware. Baby boomers are coming of age. They are demanding more technology. So it's very important they're able to provide comprehensive services to this community and help them get the latest and the best treatments.
Right. And I've been told that cancer patients, leave the area for care. And so the main reasons then would be because they're not aware of the programs that we have here.
Absolutely correct. I mean, there was a time, as I mentioned to you earlier, there was a lot of out-migration. Since then, we've minimized the out-migration of patients. Patients no longer travel out necessarily.
Right.
We have strong affiliation with centers, so when need be, we're the ones who initiate the referrals to these patients. The comprehensive services that are available in this community are recognized by the American College of Surgeons. 1 in 4 centers are recognized today, and a comprehensive cancer services center has the ability to provide the best technology, the research, and other resources, and all these services are now available in Corona Hospital. As a result, patients don't necessarily have to travel outside. The American Cancer Society supports our programs. We have support groups available to the community, so patients don't necessarily have to travel out to seek those services. Cancer patients need a lot of services, not just medical treatment or surgical treatment. They need other services. They need psychosocial support. They need financial support. They need research. They need better technology. And all these resources are now being made available to the community. As a result, they don't need to travel outside.
Right. And so how long how soon have patients been able to know that you've been here and been wanting to know about what you have here to offer?
We've been in this area for 5 years. The word is out. We do a lot of support groups. We do community lectures. We educate our physicians. We educate the medical staff. We inform them as to services that are available, and thereby the patients are attracted back to coming back to this center instead of seeking services outside this facility.
Right. And Dr. Del Campo, you being as specific into lung cancer, what are you seeing within the community? Are people really starting to come back into to see you for lung cancer service?
Absolutely. Absolutely. A lot of the patients that we used to do in Orange County, now we're doing them here. And every week, the number of patients that we operate in this hospital is increasing.
Right. And what awareness are you providing for people with lung cancer?
Well, we have given a number of lectures. We have talked to physicians. We have lectured other physicians on CMEs in other hospitals. We have talked to the community. We have talked to the Rotary Club. We're doing as much as we can for people to be aware that all these services are available here.
Okay.
We can provide any and every surgical service that is available for every cancer patient with lung cancer.
Right. Okay. And as far as the kind of surgery that you do, you talk about you doing a minimal surgery. Could you tell us a little bit about that?
Yeah. When I was in training, I was always puzzled by the fact that all patients having lung resection for lung cancer require an incision in the chest that was between 7 and 8 inches long, going all the way back into the area of the angel bone. And I always thought that this could be done through a smaller incision. So after I went into practice, I started to develop this incision being smaller and smaller and smaller, to the point that now we can do lung resections, taking out part of the lung or even the whole lung through an incision that is only 2 to 2.5 inches long.
Really? Wow.
That incision also has tremendous advantages. First, we can position that incision in an area where we do not cut any major muscles. We also have to cut the muscles that are between the ribs. And that is very appealing to patients for many reasons. Number one, they don't have the severe pain that patients have when the large muscle groups are cut.
Right.
If they have less pain, then they have less complications. They have lower incidence of pneumonia or lung collapse, and also can move the arm freely from the time of the operation. Patients who are interested in playing golf, we certainly do not diminish their handicap because those large muscles are still
Right.
preserved. Young women who want to go to the beach and wear a bikini or a small swimming suit, we can tailor that incision to the location on which it can be hidden by their clothing, and people don't have to know
Right.
that they have had surgery. To also minimize the pain, we have developed a technique on which we use a special machine to freeze the nerves to temperatures as low as 60 below.
Wow.
That controls the pain, and you can see these patients in recovery room moving freely immediately after surgery
Wow.
because they have very little pain. And also that is very beneficial for the patient and for the healthcare system because we're able to send some of these patients home sometimes the same day. We can
Wow.
take out half the lung on a patient and send it home the same day or the following day, as compared to average length of stay across the country in patients with the bigger incisions, which is about 5 to 6 days.
Right. And they would feel the effects of having those major muscles cut and not be able to recover as quickly.
Absolutely.
And so
Absolutely correct.
that's fantastic. That's really great. Well, why is the expected number of deaths related to lung cancer so high?
To lung cancer. Well, we are very active in the community trying to detect lung cancer early. Lung cancer usually doesn't give a lot of symptoms until it's advanced. So it's diagnosed late in the disease. And that influences dramatically the survival of the patient.
Right.
To give you an example, if we can catch a patient when they're developing a lung cancer that is smaller than 1 or 2 centimeters and hasn't spread anywhere, we operate on these patients and remove this tumor and treat them and so on. We can provide survival rates of 75% in average at 5 years.
Wow.
And of course, if they have gone over 5 years, then they're practically cured. There are very few that will recur after that time. So that is a great figure for this type of disease. But if we get those patients after the disease has spread, if it goes to the next stage, it decreases to about 45%. If it goes one stage further, it may be only around 20%. So the overall survival rate for patients with lung cancer is only about 12%, 10% at 5 years. Why?
Wow.
Because we're not catching them early.
Right.
So we can make everybody aware, especially those patients that are high-risk patients, you know, heavy smokers, exposure to chemicals, whatever. If we can find those patients and diagnose them early, then we can offer them many more years of life.
And the reason that, what is the reason that they're not seeking care right away, or the diagnosis is caught so late in the process?
Well, some patients do not have their regular yearly checkups. And as a matter of fact, we find a lot of these cancers when patients come to the hospital for another reason. Let's say they're going to have a small operation of other sort, you know, a hernia repair, and they get a routine chest X-ray as part of the preoperative evaluation, and then bingo, we find that there is a lesion there. And this is how we're finding a lot of these patients.
All right. Well, we're going to take a quick commercial break, and when we come back, we will pick up right where we left off.
You might take meth because of how it feels. But this is how it feels to your heart. The only difference is you can't rebuild a heart.
Welcome back to In Our Community. I'm talking with Dr. Hares Janjiani and Dr. Carlos Del Campo, and we're going to kind of pick up where we left off. You were telling me over commercial break about some of the statistics and numbers that we're seeing here in Riverside with lung cancer. Can you explain that further?
Yeah, it is somewhat alarming because I'm sure people don't realize that over the next year in the Riverside area alone, there will be 955 patients that will have newly diagnosed lung cancer.
Really?
So we're hoping that those patients can be diagnosed early rather than late, because if they're diagnosed late, the projected number of deaths this year or through a full year would be 780. So we'll be losing a tremendous number of patients unless we diagnose them early and treat them early.
Right, and so to make them aware then, to be on their yearly checkups and to be checking in and everything then. All right.
Absolutely.
And what is the main reason or cause for lung cancer?
Well, I remember reading through the history of medicine, and it wasn't that long, at the beginning of the 20th century, every time one of the professors found somebody in the hospital who had lung cancer, would go around and gather all the students and bring them along and say, hey, look at this is a disease that you probably will never see again.
Right.
And now we see them every day, and we just mentioned the large numbers. And the reason is, the number one reason is cigarette smoking. If we didn't have cigarette smoking, chemicals, pollution, and industrialization, probably we'll see very few lung cancers.
Right. Wow. And you talked a little bit about the minimal invasive surgery that you do, and what are some other technologies that have increased or improved within the past couple of years?
Well, we have both. We have new medical technology and new surgical technology. Over the past few years, also in patients in which we don't have to remove a large portion of the lung, we can use video surgery. We can use scopes, and those patients usually have incisions that are actually an inch or smaller than an inch. Of course, if we have to remove a large piece of tissue, then we need an incision that is bigger, because the tissue has to be removed out of the chest. We cannot just take it out and leave it in. But the fact that we can use these scopes, these patients are all treated as an outpatient.
Right. Wow. And that's definitely good news for our community, and to know that recovery is just a lot quicker than it used to be.
And less painful.
So that's great. Well, as we know, Peter Jennings was recently diagnosed with lung cancer and has brought everybody into realization of how effective and how important it is to be aware about lung cancer. And what can be done to treat patients who are diagnosed with lung cancer? If they come to you, and what is the first step that you'd want to take with them?
Well, early diagnosis, as Dr. Del Campo mentioned, is extremely important. If you can pick up the cancers early, if you can diagnose the cancer early, we can treat them more better. The results are much better. The flip side is the great majority of the lung cancer patients today are treated at a very, very late stage. As a result of that, the survival is not as good. Also, in the last 10 years, we've had a lot of new drugs in this disease. As a result of that, we are beginning to see patients living with disease for a longer time. We have a better understanding of lung cancer today. We treat from stage 1 to stage 3 are treated very differently. We have new therapies, new target therapies, such as Avastin, such as Tarceva. These are specific drugs that affect on a certain protein on the tumor cells. And as a result of that, these drugs are eventually going to impact the survival in lung cancer. We're not where we are in breast cancer today, but I am hopeful that we will be in the next 5 years. We will be where we are today in breast cancer. So the new cytotoxic agents, new target therapies are going to have an impact in this disease. But the key factor is we need to minimize smoking. We need to reduce the incidence of smoking. We need to pick up the lung cancers early on so we can better treat our patients.
Right. So the main thing you want to express to our viewers is that obviously early detection of lung cancer is really important, and also to know that they can be treated here in Corona.
I think that's very true. I think if you've seen increased survival rates in breast cancer is because of the mammogram. The mammograms have early detection, so patients are diagnosed early. There's more awareness. We are curing more patients. You look at colon cancer today. colon cancers, we recommend screening colonoscopies as well, that we can diagnose polyps early, we can prevent the incidence of cancer. You look at prostate cancer today. 10 years ago, we came with a test called as PSA, which is a blood test, very specific for prostate cancer. So all these tests have increased the awareness, are helping us diagnose patients early on, and we're seeing higher good survival rates in these diseases.
Right.
And we're hopeful that as patients continue to seek early care early on, we will be able to cure more patients.
Right, right. And I'm going to go back to you, Dr. Del Campo, about the reason and the cause for lung cancer. Smoking, you said specifically. Now, I know teens are really influential, and especially with smoking. Is it gonna take a while for them to be smoking and then to see the side effects with lung cancer? What can we do to teach our young people about the awareness of smoking and the cause of lung cancer?
Well, it is very difficult to convince teenagers that they are not immortal. That is the problem. Teenagers, you and I were teenagers once, and we know that we take risks and we think that things are never going to happen to us. So to try to, in my experience, to talk to teenagers and tell them you may get lung cancer, you may get these complications and so on, it doesn't work very well. What teenagers don't like is the fact that if they smoke, they are under somebody else's control. They become slaves of the tobacco companies and become slaves of whoever sells them the cigarettes.
Right.
And then they rebel against this. So when I see them and I talk to them and so on, in my experience, when I approach them that way, are more likely to avoid the smoking than if we tell them of the complications they could have as part of the disease.
Right, right. And because I believe it's very important to have the awareness for our young people, and you know, like you said, with early detection and prevention, we could definitely see a decrease in lung cancer, possibly. Is that
Absolutely.
Yeah.
That's very true. Prevention is important, and early detection is equally important in this disease.
Right, right. All right. Well, we're going to take another quick commercial break, and when we come back, we will talk to Dr. Del Campo and Dr. Giangiani a little bit more about cancer. We'll be right back.
Picture this. This is your business. Now, this is your business with the chamber. Get it? Networking with others can make a big difference.
Do you know www.coronachamber.org has over 19,000 hits a month? Come, join us. Add your voice to the 1,000 member strong Corona Chamber of Commerce.
Be a part of the Corona Chamber of Commerce.
Welcome back. Well, we're going to pick up where we left off, and you're going to talk a little bit about the technology that you have here at the Corona Regional Medical Center for Cancer. Could you tell us a little bit about
We're
that?
very pleased with all the diagnostic tools that we have in this institution. We have MRIs that are very sophisticated. We can do something that is called a PET scan for people who are not familiar with it. When we do PET scans, it tells us the activity of the tumor, and then we can narrow down those that may or may not be cancer. And just recently, a couple of months ago, we acquired the most sophisticated three-dimensional PET scanner.
Wow.
That you can take slices and then put them together and do a reconstruction. It's three-dimensional. You can put color. You can remove organs on the PET scanner to see this and to plan all the sophisticated surgeries. Now, the great news about this is that not everybody who is diagnosed on a chest X-ray with a lump in the lung or a nodule is going to have cancer. So we can really narrow down with technology, and in many occasions we don't have to operate on these patients that we used to operate on before, because we just follow them and see if there are any changes or not. So we can also save a lot of people surgery.
Right. All right. Well, what message would you like to leave our viewers with today about what you have here regarding local cancer services? Excuse me.
Well, first, quit smoking so that we don't have to use those services. And then for all those who may be at risk, to be diagnosed early. And second, for them to know that we have all the treatments available for them in our institution. And there are also some clinical trials with new cancer drugs, and Dr. Yanjani is much better qualified to talk about that than I am. So we can provide just about every service that is needed.
Right. And Dr. Giangiani.
Well, we've come a long ways in cancer medicine. We've come a long ways in corona also. We definitely have better technology here right now than we had several years ago. We have the MRIs, the PET scans, and the CAT scans, which are very important in diagnosing cancer early on. But we also have research available here at our facility to our community. We've been doing clinical trials for many years. We've been doing clinical trials for 15 years. We're doing clinical trials right now in practically all diseases from colon, breast, lung, prostate, you name it. We have clinical trials. Clinical trials are basically newer drugs, newer treatments to treat patients with the best possible treatment available, or new innovative treatments coming down. So we have all the resources here. We have the support of the American Cancer Society. We have support groups for our patients to help them go through when they are going through cancer. So we have all the ancillary care. We have the diagnostics. We have good research. We have good surgeons. And as the program is developing, we are putting more and more resources into having a strong oncology-based program here, so our community does not need to travel outside. We can bring the care to them at home. That is ultimately our goal. As a medical director, we have what we call as working tumor boards, where every new case that's diagnosed is presented in front of pathologists, radiologists, surgeons, and we all come with a team approach, so the patient receives the best and the latest treatment that's available to them. So it's no longer a one physician who is making the diagnosis and recommending a treatment. It's a team approach, and that's the only way we can get good results in cancer medicine today.
Right, and that's great to know that everybody's working with each other to serve the patients to the best of their ability.
That's very true, Aaron.
All right, well, that is all the time that we have for today. I don't know if there's anything else that you want to say about cancer, or let's go ahead and tell our viewers where they can reach you at.
Well, we have offices on the campus of our Corona Medical Center. Our office is located right on the campus here, and patients can seek us either directly. They can come and see us, or they have to be referred via their own physicians.
Right.
And that's how the patients often seek attention. Being in practice for so many years, I get a lot of second opinions and referrals from my own patients who bring in their family members for us to take care of them here.
And is there a number where they can reach you at?
Well, they can reach us at 951-371-2411.
All right, and Dr. Del Campo?
At the Cancer Center. If anybody wants to reach us here, the Cancer Center is the place to be, and that is here inside the hospital, and the phone number is 951-737-7474.
All right. Well, thank you very much for both of you being here today and taking your time.
Thank you very much.
And I believe this is very important to make people aware of how important it is to know and be aware. So I thank you very much. All right. Well, please join us again next week. We'll be right here, and we'll talk about more in our community.